I'm Alexis Dinno, and I'm an associate professor at the Oregon Health and Sciences University - Portland State University School of Public Health. I teach methodology courses on like introductory epidemiology or social epi methods and theory or biostatistics courses, but also courses about health equity and courses centering justice. I'm transgender myself and queer, in using a variety of labels. And I think about how things like demographic questions, whether it's on a survey or whether it's paperwork someone's filling out when they come to a front desk, how that does so many things. It affects the nature of a relationship between a person on one side of the counter and the other. It affects the relationship between a patient and a provider, and it also affects the quality of our science. Trans folks have, as all folks have needs, right? And transgender people have a need for respect and dignity around things like pronoun use and around things like name use. And because pronouns and names are institutionalized and colonized in terms of what counts as a name, what counts as a gender or something like that, folks who don't fit sort of the hegemonic, the broader societal narrative, are more vulnerable. There's that uncertainty about, is a clinic going to be friendly or not? I had my last two providers, I have adored primary providers. I've adored, and they both retired on me. And recently, and I haven't gone in to see my new provider because it was just assigned to me. I didn't get the opportunity to say, hey, I'd like to find a queer provider, a provider who specializes in transgender care, this or that. And so I'm feeling a little reticent. The question of access is important. I mean, I'm 53, I'm an advocate. I know the trans health serving professional community because I meet with them professionally, fairly routinely. And yet even I can have this kind of inhibition around access. There's a philosophy called cultural humility, and it's emerged and in some ways is a response to notions of cultural competence. Cultural humility, though, just recognizes that the relationship is in part a co-learning relationship, co-teaching, co-learning, and collaborative. And so it asks that the providers come with some humility to say, who is this person? And again, centering the person there in their care. I think that the collaboration in education space should be made for that, like welcomed and made for that. And that's also part of that cultural humility frame that some providers profess and try to work with. So the political climate is that some states have an interest politically in punishing queer people and queer bodies and really institutionalizing that punishment in law. And this terrifies transgender people. This terrifies queer people. It also terrifies the families, like the parents of queer people. The way we can show support is by organizing politically to get rid of such anti-public health laws, to get rid of such public harm laws. In fact, we can also, at the level of the clinic, we can work on that inclusion. If you're running a clinic, you can train your staff and yourself to welcome folks, especially that stuff about names and pronouns and asking people what's going on with their body. That welcome inclusion component I would say should also extend to parents, and that can happen, and other caregivers, asking these kinds of questions of young people and of their parents. I can tell you that parents who have gender nonconforming children are so glad when they just see the opportunity to say, yeah, actually, I want to talk about this. I think that issue about welcome and inclusion applies no matter the specialty or the general practice of any provider, but also recognizing where things like sex intersect and reproductive biology intersects with bleeding disorders in ways that are interesting, right? And definitely affect things. The way health and disease play out. I think there's a real possibility for gain by recognizing that we can ask questions about people's bodies and about their their anatomy and their physiology in a way that will lead to the best quality of care for them.